affect the government. And from the outset, we want to say that we are very committed to ensuring the safety of our children in society. And we do not want the issue of education to be politicized by political actors such as the former UDA Secretary General to settle political scores on account of saying that he's a thespian, is a playwright for many years. No, that is not acceptable. We know very well if it would have been any other person, that would not have been in question. But the person involved in this whole issue has had a fallout. We, the current administration, at some point he was a senior official at any given cabinet, and he has used this opportunity to fight back the government using our children, and of course as a front. And that is playing drama, using drama to play drama. I mean, how do you do that? How do you front children and then claim that they are the ones who are being attacked? It is regrettable, of course, that our police used tear gas against the journalists and also the children. That is regrettable. And as a government, we would want to say that is not acceptable and action shall be taken accordingly. However, it is important to set the record straight that matter has been highly politicized, and of course, every other Tom, Dick, and Harry, they have jumped in, to mince political mileage out of it. It's unfortunate, and we will not tolerate, as a government, going forward, such behavior. The rules must be followed. Teachers must ensure that they have the right people who train their children, in terms of competition, so that there is also fairness, and so that then we also do not end up using our children as a shield or also as an opportunity to express ourselves politically for the sake of it. Let me now turn to the issue of finance bill and taxation. Contrary to misinformation circulating online, the 2025-2026 budget process is still underway. No finance bill 2025 has been proposed, drafted or tabled in Parliament. As per established timelines, revenue-raising measures such as a finance bill only follow the release of the draft budget after April 30th. Kenyans will be fully engaged through public participation once the finance bill is officially submitted to Parliament. The government unequivocally states that there is no finance bill 2025 tabled anywhere yet, and such outrageous claims should be shunned. And we are calling upon the members of the press to help us so that we do not spread propaganda. Accordingly, Kenyans will have the opportunity to interrogate any revenue-raising measure through a thorough public participation only after the draft budget and finance bill have been released by the National Treasury and submitted to Parliament. The major intervention thus far is the budget policy statement. The BPS outlines the government's strategic priorities and ceilings to guide the national government, county governments, and independent constitutional institutions in preparation of the budget. So this is the BPS. It says how much money can you actually spend. On 30th of April, we'll have the various appropriations, the appropriations bill, as we know it as the budget. The 2025 budget policy statement is a third to be prepared by the Kenya Kwanza administration, and the government's fiscal policy year 2025-2026 and the medium term places special emphasis on fiscal consolidation and budget restructuring to reduce public debt vulnerabilities while providing fiscal spaces to deliver essential public goods and services, to boost revenues, and to emphasize on the fact that we need a combination of tax administration and tax policy measures, and not an increase of taxes as alleged. The government will also focus on strengthening accountability, transparency, and efficiency in public spending. Let me now turn to the issue of guaranteed minimum returns. In the Kenya Kwanza bottom-up economic transformation agenda, the better plan, we made a solemn pledge to transform Kenya's agricultural sector into a powerful engine for economic growth, food security, and farmer prosperity through subsidizing productivity and value addition. As we promised, the government is implementing the guaranteed minimum returns to assure farmers of predictable incomes. This has significantly stabilized farmer earnings and reduced the vulnerability to market volatility, hence a true realization of our campaign slogan of Pesa Mfukoni. These tangible outcomes are as a result of prioritizing production instead of subsidizing consumption. For example, macadamia now is going for 100 shillings per kilo, making Kenya the leading global producer. And this is something we should be proud of. thanks to proper scheduling and a shift to production subsidies. Coffee, through the Coffee Cherry Fund and other policy measures, coffee farmers now earn an average of Kenya shillings 130 per kilo, up from Kenya shillings 50, with payouts sent directly via M-Pesa. On milk, the farm gate price for milk was raised from Kenya shillings 37 to 50 per litre, boosting dairy farmers' income significantly. When it comes to sugarcane, farmer earnings have actually risen from 4,500 to Kenya shillings 5,300 per metric ton, which is an increase of a whole 800 shillings, with some of the farmers actually receiving bonuses for the first time in a long time due to improved support for farmer production, including debt cancellation. When it comes to Mira farmers have seen increase of all the three types of Miras: grade 1 from 700 to 1,300, grade 2 from 350 to 700, and Alil grade from 500 to 1,000. On tea, the government has promoted local value addition to tea, enabling the export of processed tea and increasing returns to farmers. On avocado, Kenya becomes fast Africa's top exporter and producer of avocado, reflecting successful policy support and market access. And we are calling upon farmers to continuously take opportunity to grow avocado because it is very, very important. The same case with leather, with a renewed focus on tanneries like the one in Narok, which we visited the other day with my office. And the leather sector is expanding, creating value addition opportunities and strengthening local production. And in fact, we even bought shoes that are now locally produced. And we are very happy that they are actually of very high quality, especially the school-going shoes are very, very nice. And the various kinds of leather, including even from crocodile and other kind of skins. When it comes to Taifa Care, last year the government introduced SHA, Social Health Authority, now known as Taifa Care, which of course we are very happy to have Dr. Masi Mwangagi as the new CEO. And this is according to our promise of universal health coverage for all Kenyans. This initiative is aligned with the Kenya's commitment to the UHC as and of course under Vision 2030, but also within the fourth medium-term plan, MTP4. And of course, it marks a transformative shift from curative out-of-pocket healthcare to a publicly funded solidarity-based model. And it is important to say that it is contributory also to 300 shillings every one of us and above. And so it's important for many of us to pay so that then more people can benefit. Taifa Care guarantees healthcare access for all Kenyans, regardless of income level or employment status. Every citizen is expected to register under the new program to benefit from its wide-reaching health services. Taifa Care covers outpatient and inpatient services, maternal and child health, emergency care, mental health services, very important because there are very many cases of mental health nowadays, and chronic and critical illnesses, such as cancer, diabetes, and hypertension. It aims at reducing out-of-pocket expenses that have often led to poverty due to high medical bills. Further, the national government and the Council of Governors had a bilateral health summit to review the progress of Taifa Care, 140 days since we commenced the rollout of the program on 1st of October 2024 to ensure seamless implementation. Over 19.7 million Kenyans are now registered under Taifa Care, up from 8 million under the defunct NHIF, translating to 146% increase. And with this also, over 8.5 million Kenyans have visited for various hospitals for checkups. Out of these, 331,265 Kenyans were referred for diabetes treatment and 711,172 referred for hypertension checkups. Recently in a hospital, a single mother, Amina, held her son's hand tightly as she underwent cancer treatment, her heart heavily with worry, not just for his health, but also for the mounting bills. Then came the transformative news. The Social Health Authority has upgraded its system, ensuring hospital claims are processed by the 14th of each month, easing financial burden for countless families. Alongside this, SHA has boosted ICU and HDU daily rates from the current 4,480 shillings to Kenya shillings 28,000 per bed night, and raised oncology coverage from the current 400,000 to 550,000 per patient, offering Amina and many other Aminas like her a lifeline. The government is in the process of rolling out daily payments through M-Pesa to ensure that Kenyans who cannot afford to pay lump sum amounts of money do so at their own convenience. The government urges those who have not registered to do so in order to enjoy the full benefits of Taifa Care. It is regrettable that we have a disease outbreak in northern Kenya called Kala-Azar. Kala-Azar, also called visceral leishmaniasis, is a life-threatening disease caused by a parasite transmitted through the bite of infected sandflies. It may affect many people in arid and semi-arid counties, including Turkana, West Pokot, Baringo, Isiolo, Wajir, Marsabit, and Garissa. In Wajir County, the Kenya government has swiftly responded to the recent Kala-Azar outbreak, which has affected over 600 people and claimed 33 lives since September 2024. We send our most sincere and heartfelt condolences to the departed. The Ministry of Health is closely working together with the Wajir County government and has deployed 3 mobile laboratories in Eldas and Wajir West, enabling rapid testing for those unable to reach hospitals. A satellite blood bank equipped with a new blood analysis machine has been established to support critical care, significantly improving patient outcomes. And because of these efforts, therefore, recoveries now surpass new infections. This is very important, with hospitals discharging more patients than they admit. The government, through the Ministry of Health, continues to bolster resources and coordination to contain the spread, urging communities to seek early testing and treatment to prevent further loss. On cholera, the government acknowledges the recent rise in reported cases of cholera, a waterborne disease that poses a serious public health risk. In Nairobi's Kibera settlements, 12-year-old Mercy narrowly escaped tragedy when a sudden onset of watery diarrhea signaled cholera's outbreak. Thanks to rapid intervention at a local health facility, she has recovered fully, a testament to the government's ongoing efforts to combat these and other diseases. As of 8th of April 2025, a cumulative 100 cases and 6 deaths across Nairobi, Migori, and Kisumu counties have been reported. Once again, we send our most sincere condolences to the 6 who have lost their lives. The government has initiated a multi-sectoral rapid response team to curb the outbreak. Surveillance has been intensified in all sub-counties and border areas, with isolated facilities fully equipped with treatment guidelines, healthcare workers, and medical supplies. The government has distributed critical resources, including medicines, lab kits for testing, and protective gear to frontline responders. Public sensitization campaign is in full swing, leveraging on local radio public forums and door-to-door outreach to promote hygiene, water treatment, chemicals, soap, and hand washing stations across so that they can be deployed effectively and so that people can use them. And we urge the media to actually help us in this. The government, in collaboration with various partners, is working diligently to address the cholera outbreak in the country and urges the public to remain vigilant, adhere to health guidelines, and report any symptoms promptly to healthcare authorities. The government remains committed to updating the public with any new information and developments further to mitigate this outbreak. Let me now turn to the issue of education. The government has taken note of recent developments in the education sector, particularly the regrettable incident involving Butere Girls High School students during the ongoing Kenya National Drama and Film Festival, the unlawful withholding of national examination certificates by certain school principals, and the progress on reforms of the university funding model. With regards to the Butere Girls High School play, Echoes of War, the government is fully seized of the matter and considers it serious enough to warrant a comprehensive review of the circumstances that led to the disruption. The government remains committed to nurturing artistic talent and freedom of expression, encouraging youth to express themselves and to participate in creative expression as outlined in the Digital Superhighways and Creative Economy pillar of the Better Plan. However, such creativity, especially in school environments, must be done within the parameters of clearly defined rules and regulations. The rules governing the Kenya National Drama and Film Festival unambiguously state that all performances must adhere to adjudicated scripts, and all training of students must be conducted strictly by registered teachers or accredited instructors affiliated to recognized education institutions, not like those ones who pontificated themselves on national television as if to gain political mileage. The introduction of unapproved individuals, including those outside the teaching profession, into school-based co-curricular activities constitutes a violation of both ministerial regulations and the TSC Code of Conduct. The conduct witnessed in the run-up to the planned performance was not only irregular, but posed a serious threat to the integrity of school-based co-curricular activities. The Ministry of Education has not taken any disciplinary action against the school's management, as the matter is still under active investigation, and appropriate action will follow based on the findings upon conclusion of internal disciplinary hearings. The government remains clear that Kenyan schools are not arenas for political experimentation, nor shall our children be used as pawns in political ideological contests. Schools are safe spaces for learning, creativity, and character development, not platforms for provocation. Moving forward, the Ministry of Education shall ensure full compliance with festival rules and shall conduct a thorough review of the regulations to forestall any repeat of such unfortunate occurrences. It doesn't matter what has happened in the past. Things must change going forward. On national examination certificates, the government is aware that despite repeated directives, some school heads continue to unlawfully withhold certificates for students over fees-related issues. This is not only illegal, but it is unacceptable.